Take 24. Hi, how are you today?
Good.
My name is Bailey. I will be your nurse, and we will be performing the head to toe assessment. Can I get your name and full date of birth?
Sarah Zerman, 03/08/1999.
All right, perfect. Can I have you walk over to the examination table? Okay, so the patient appears the stated age. The patient appears calm and collected with her ability to be able to hear me. She's able to walk over here. Face is symmetrical, no drooping or anything. Posture is good. The skin appears pink, warm, and dry. She appears well nourished, and her personal hygiene looks great. No obvious signs of deformity, and her level of consciousness appears to be there, with her being able to answer my questions, stating to me her name and her date of birth. Okay, so next we will be doing vital signs. The first part of the vital signs would be to take her oral temp. If I had the oral thermometer, what I would do is I would take the oral thermometer, turn it on, put the plastic protectant over it, put it under her tongue, take the temp, read the temp, and we would want it between around 98.6, which is the perfect temp. Next, I will be taking your pulse and your respiration, so if I can just come over here. All right, pulse was 82 and the respirations were 17, which is good. The next thing I would do was to take her blood pressure, but I do not have a blood pressure cuff. So if I had the cuff, what I would do is I would wrap the cuff around the upper part of her arm, pump the bladder up, and I would slowly release, with the first tick being the systolic and the second tick being the diastolic, wanting it around 120/80 or a little less than that, which would be great. The next part of the assessment would be the pain assessment. So Sarah, on a scale of 0 to 10, 0 being the least amount of pain, 10 being the most amount of pain, what would you rate your pain?
0.
0. That is great, and that is what we like to hear. So after the vital signs, we are going to do a neuro level of consciousness check. So do you have any dizziness, loss of memory, any changes in memory, things like that? No trouble finding words? No. Okay, so do you know where you're at right now?
Yes, I'm in the clinic office.
In the clinic, yeah. Do you know your name?
Sarah Zerman,
Do you know your birthday?
03/08/1999.
All right, great. Okay, now on to the head and the face. So have you had any headaches, any dizziness, any recent surgeries or falls?
Nope.
All right, so now I'm going to be palpating the cranium and feeling for the texture and distribution of the hair. There are no obvious lesions or anything. Hair is not brittle, it's not dry, and the head is symmetrical without any lumps or bumps. And the face is symmetrical on both sides. There's no drooping, twitching, or anything like that. Okay, so on to the eyes. Do you have any dryness, blurriness, any changes of vision?
Nope.
No? Okay. Do you wear contacts or glasses?
I wear both.
Are you wearing contacts right now, I'm assuming?
Yep.
Okay, so now I'm going to take a look at your eyes and examine them. So the iris and the pupil and the sclera and the conjunctiva look great. They look moist, no swelling or redness or anything like that. So next I'm going to perform an assessment to look at your extraocular movements. So I'm going to have you follow my finger in 6 cardinal directions. So if you could just look at my finger and follow my finger for me. Perfect. All looks great. Now I just need to find my pen light. Next I will be forming the Perla exam. So I'm going to have you look at my ear and I'm going to shine light to the side. Good. good. Eyes are equal, round, reactive to light, and accommodating to light. So that is all good news. Next, I would be looking at the ears. Subjective data for that. Do you have any unusual discharge? Any ringing, hearing things? No, any pain or tenderness, things like that?
No.
No? Okay. So I'm going to be looking at these and assessing these. No pain when I touch.
No.
Ears appear to be symmetrical. There's no redness. They're not hot. No swelling, no tenderness. So that's good. Okay, onto the nose. There's no obvious deformities I see. So any unusual discharge, frequent nosebleeds, any pain in your sinuses or around there?
No.
No? Okay. Alright, I'm going to perform the patency test. So I'm going to put a finger in your nose, have you inhale to see if you're able to breathe air in on each side. So this side, and then this side. Alright, all is good there. Okay. So now I will, even though you said there's no pain or tenderness in your sinuses, I'm still just gonna palpate those to see if we're missing anything. So all is good there?
Yep.
No pain, no tenderness. Okay, now onto the mouth. Do you have any sores in your mouth, any bleeding gums, difficulty swallowing?
No.
Nothing that you noticed? Okay. So I'm gonna look in your mouth, just look around there. So looking right straight forward at you, your lips look good. There's no cracking, you must hydrate them well, so that's good. Okay, looking at the buccal mucosa, pink, looks moist, normal, as well as the tongue. Your gums look great. Looks like you brush twice a day, I'm guessing, and your teeth are very straight. You must have had braces, which is good. Okay, on to the neck. Do you have any pain or stiffness? Any recent surgeries?
No.
Any unusual lumps or bumps?
No.
No. Okay. So I'm going to look at your trachea, and it appears to be midline, which is good. If it wasn't, that would indicate a further problem, which would be pretty bad, so we don't want to get you in somewhere. Okay, now I'm going to feel your carotid pulse on each side, one at a time. Good. And good there. Okay, now I'm going to assess your lymph nodes. I will also be doing the facial ones, just so we can do them all at once. Starting in the front of the ears. No pain, just let me know if there's any pain. Cervical ones, moving on to the anterior neck. And around the clavicle. Good. Now we will do range of motion and muscle strength. So if you can look up for me, then look down for me, and then look side to side. And then if you can just go against the resistance of my hands. Alright, good. Now we do the posterior chest, some subjective data for that. Are you short of breath at any time during the day?
Mm-mm.
Do you smoke?
Mm-mm.
No. Do you have pain with inhalation or exhalation?
No.
No? Okay, so if you could just stand up for me and face the wall. So looking at the back, the posterior part of the chest, it all looks symmetrical bilaterally. Now I will test for symmetrical expansion. So if you could just breathe in for me. Breathe out. Good, now I will listen to breath sounds. Just taking a deep breath, if you will. Good. Very good. Alright, all looks good there. Equal expansion, everything looks symmetrical, and breath sounds are clear. Onto the anterior chest. Again, you said no shortness of breath or anything.
Yep.
Okay, good. So, again, everything is symmetrical. Contour looks good. Take a deep breath for me. 2 more. All right, breath sounds are clear. On the interior side, okay, on to the heart. Do you have any history of heart disease in your family? Chest pain?
Nope.
No? Okay, great. No abnormal palpitations or anything that you can feel. Okay. I will now be listening to your heart in all of the fields. All right, heart sounds sound good. They're nice and clear and normal. Okay, you can sit back down for me. Onto the breasts. Okay, so I will not be performing a breast assessment today, but the questions that I would ask my patient if we were, well, what I would do is I would have them lay down. Usually you can see best if you have your arms up, and then I can feel around in a circular motion. Usually we go clockwise, but some subjective data I will ask you is, do you have any lumps or bumps that you have noticed? No. Any abnormal discharge, deviation of the nipples or anything? Do you perform monthly breast exams?
No.
Okay, so what we recommend for that is before your period, usually at the same time of the month, once a month, it's just to even just look at yourself in the mirror with your arms up, just looking for any deviation and just going in clockwise motion, especially in the axillary region with 3 fingers, and just palpating around in circular motions for that. Okay, so the next part of the examination will be upper extremities. So with upper extremities, have you noticed any numbness or tingling, pain in any joints or muscles, limited range of motion,
No.
tenderness, heat, anywhere? No. Okay. So first thing we'll do is range of motion. So I'm gonna have you lift your arms up, lift your arms back down, and then I'm gonna have you lift your arms in front of me and go against my hands. Other way. All right, strength is great. Okay, if you can have your arms out like this, you can relax them. I'm gonna take your radial pulse. All right, they are nice and equal bilaterally, 2+. I'm gonna look at your nails. Your nails look nice and healthy. Looks like they're nice and polished and clean. I'm gonna check your cap refill now. We want it under 3 seconds. We'll do it a couple times. All right, all looks good there. Okay, now I'm going to have you lay down in the supine position for me. We're on to the abdomen. And the questions I have for this, subjective data, is do you have any nausea or vomiting, any changes in weight, changes in appetite, pain in the area? No. Okay. So the contour and symmetry of your stomach looks good. It looks normal. It looks like there's no obvious distension going on or abnormalities. I'm going to listen to your bowel sounds first. I'm going to auscultate starting in the right lower quadrant. Alright, bowel sounds are present, which is awesome. I will now lightly palpate around. You have no pain or tenderness in your stomach right now? Okay. I'm going to begin with light palpitation. I'm going to go with one hand with fingertips, just looking for any obvious distension that I will be able to feel with light palpitation. Alright, everything feels and looks great. Now I'll begin deep palpitation. It's going to be a little harder and a little more firm. Alright, everything feels good there. Now on to the lower extremities. So first thing I'm going to do is I'm going to test your range of motion. So if I could just have you bend your knee to your chest on each side. Good. And then lift them straight up. Good. I will now test your strength. So if you could lift this leg up for me and go against my force. Good. Very strong. No pain or stiffness in your lower extremities. No heat around joints. No numbness or tingling. No. Okay, I will now assess your pedal pulses. All right, good there. Very good. I'm gonna come over here. Good. Perfect. Okay, you can sit back up for me. I will not be performing a rectal or genital assessment, obviously, but what I would do is ask you some subjective data and then we could pursue that. So, have you noticed any abnormal discharge lately? No mild order discharge, any change in color?
No.
Any dark tarry stools that would indicate blood?
No.
No blood in your bowels. Do you have regular bowel movements?
Mhm.
All right, perfect. All right, thank you for today.